I'm Dr. Eppley, plastic surgeon of Indianapolis, and I wanted to share some thoughts with you in regards to cheek augmentation. Of all of the facial enhancement or augmentation procedures, cheek implants are not done as commonly as chin implants, for example, but they are nonetheless a very useful cosmetic facial procedure. In my experience, cheek augmentation is generally done in two types of patients. The first patient may well be younger, but it is someone who has had a weakness or inadequate fullness of the cheek areas, and they have known that for some time since they were born. You might call this a congenital deficiency or weakness of the cheek area. In some of these cases, the upper jaw may well also be short, which could be found in some of the more severe cases of significant cheek hypoplasia. The second type of patient, and probably more common, is in the older or aging patient who has had some mild cheek deficiency, but it has never been a cosmetic problem before. But now that they have started to age and the cheek tissue is starting to sag, the combination of weak underlying bones and sagging tissue makes the deficiency in the cheek area more pronounced, and they might benefit through cheek augmentation by having sort of a implant mid-face lift. When we talk about cheek augmentation, or specifically cheek implants, be aware there are numerous ways to highlight the cheek area. Implants are by far and away the most common and certainly are the most simplest. The idea of moving the bone or adding bone grafts onto weak bone is really not a very good one most of the time, as it is a big operation and it is not always the most reliable in terms of the augmentation surviving and maintaining the position that you want it to do. You could also use fat or other types of injectable fillers, and this can be a good temporary fix, but it is not permanent and it is difficult to make that area smoother. So cheek implants or synthetic implants are certainly the most effective way to do cheek augmentation. When we talk about cheek implants, while there are numerous styles available, fundamentally think of them as being of two types. Those type of implants that sit on top of the cheekbone, really what you think of as traditional cheek implants. And then there are those implants whose objective is to not increase fullness to the cheekbone proper, but to add volume or fullness to the area beneath the cheekbone, otherwise known as the submalar or buccal space area. These are two fundamentally different types of cheek implants, and they really achieve slightly different areas of enhancement in the cheek area. From an operation standpoint, cheek implants are relatively simple to do. They are done through an incision inside the mouth, which is the most common way. It is also possible to do this through an incision through the eyelid, but this would only make the most sense if you were having some eyelid surgery done at the same time. As one goes through the mouth, the cheek bone area is an easy area to get to. That's relatively quick. Once the implants are in place, I personally prefer to put a small screw to hold them into place, but many plastic surgeons do not, and there are certainly nothing wrong with just suturing them or sliding them into place. I prefer a screw so that I have confidence that I know that the implant is really never going to move or eventually come down through the incision in the mouth even years later. Done in isolation, cheek implants are relatively quick and easy procedures to do that really have only a very modest amount of pain. There is a mild amount of swelling that will occur, but generally there's going to be no bruising. You will probably look like you have too much cheek fullness for the first couple days or week, but that will settle down quite quickly. Other than that, there are really no specific recovery issues that I have for my patients. You can resume any type of activity you want as soon as you feel capable in doing so. I would advise that if you're considering cheek augmentation that you have a really good in-depth consultation with your plastic surgeon and certainly go through some computerized digital analysis of what the result may look like for you. The cheek area is a hard area to visualize, unlike the chin, and sitting on the computer and going through some imaging can really help you understand what a cheek implant or a submalar cheek implant might do. I hope this information has been helpful to you. I'm Dr. Barry Eppley at Plastic Surgeon of Indianapolis, and I wish you the best on your cheek augmentation experience.